Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 204 of the Ask Dr. Angela podcast. I'm so excited today. It's really cold out here on the Jersey Shore. I mean, it's crazy. I think Wednesday it was like almost 70 degrees, no jackets required. And then the following day, it was freezing. We got snow, and they're saying something about a nor'easter next week. It's like, can you believe it? The weather's all over the place, which explains why so many people have been sick. I mean, my wife's been sick, my daughter's been sick. I'm the only one that hasn't been sick, and it's probably because I've been exposed to every germ and bacteria known to man. I mean, when you're a physician and you're in the hospital all the time, you have had exposure to probably every superbug in existence. And so my immune system is like crazy strong, superhero status strong. Anyway, after I am done here, my mini and I are going to have some mommy-daughter time, and that probably is going to involve some reading time at a cafe and then some video games, because mommy is a gamer, Dr. Angela is a gamer. So that's something that my little one and I enjoy doing. So this is funny. So I recently did a DaVinci hysterectomy on a patient. And if you don't know about DaVinci, you better ask somebody. It's like a minimally invasive way to do hysterectomies. It's like not your mama's hysterectomy. We do the surgery through like 4 very small incisions, and you go home, if not the day of surgery, the following morning, and recovery time is crazy. It's like so quick. But anyway, I saw this young lady for a 6-week post-op visit, and we had done a DaVinci hysterectomy on her. We left her ovaries, but took her uterus and cervix out. And so she comes in for her 6-week visit, and I'm like, how are you doing? And she's like, oh my gosh, I'm doing great. I'm so much better. My periods aren't heavy anymore, and, I'm not having pain. And so she looks at me and she goes, but I got a question for you. I still haven't gotten my period yet. And so I looked at her, I tilted my head to the side, and I was like, huh? And I mean that in like the best way. But what constantly comes to mind for me, and what I'm constantly reminded of, is that lots of women just, not in a bad way, but are clueless about female anatomy and kind of like what the function of their various organs are. And so I said to her, like laughing and joking, I said, well, girlfriend, you're not going to get any more periods because I took out your uterus. And of course, she was like ecstatic, over the moon, like cartwheel doing happy, It's just like crazy, because what woman do you know that likes her period? I can't stand my period. And I'm not going to have a hysterectomy, but I can't wait until I'm like done with that. But what's funny is that she didn't realize that once we removed her uterus that she would no longer be getting her period. So what I explained to her is, so this is the deal. You do still have functioning ovaries, because if we had taken the ovaries, it would have put you into a surgical menopause. Perhaps hot flashes, night sweats, dry vagina. Who wants that stuff? Not any sooner than you're going to get it. But anyway, I said to her, when your ovaries release the hormones, the estrogen, which causes the lining of the uterus to grow or proliferate, and the progesterone that causes you to shed that lining, you don't have a uterus for the ovaries to affect. So you're not going to get a period anymore. And of course, again, I love being able to deliver that news because she had no idea. So remember, ladies, when we take out your uterus, that's it. No more periods. And quite frankly, if we've taken out your uterus for benign reasons, i.e. for heavy bleeding, fibroids, and you have no history of any abnormal pap smears or cervical dysplasia, which translates into abnormal cells on your pap smear, quite frankly, from that point on, you really don't need to be being screened with pap smears anymore, because what do pap smears screen for? Ding, ding, ding! Absolutely right. Cervical cancer. And if you don't have a cervix anymore, what's the use? But again, remember, that's only if your hysterectomy was done for a benign reason and you don't have any history of any abnormal pap smears or cervical dysplasia. So hopefully, for those of you that had no idea about this has shed some insight into this particular situation. It's always fun being able to make somebody's day with just, a pearl of wisdom. Who knew? Anyway, thank you so much for tuning into today's podcast. If you happen to have a question or an issue or topic that you would like featured on the podcast, go to www.askdrangela.com. That's AskDrangela.com. You can either directly email me, you can direct message me on any of the social media avenues, which are also featured on the website. Please also make sure that you check out our weekly blog posts, which are hilarious and informative. Sign up for the podcast, as well as sign up for our YouTube channel. In closing, I would like to leave you with this. And this is again from one of my favorite inspirational books. Congratulations, graduate. It says, life's challenges are not supposed to paralyze you. They're supposed to help you discover who you are. Until next time, look better, feel better, be better. Looking forward to reconnecting on episode 205 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.